Thank you, Mayor Pete, for being here. Reagan, thank you so much for sharing your story and Ethan's story. So, Mayor Buttigieg, I'm also I'm a parent of a child who experiences a life-threatening health condition who was born prior to the ACA repealing the lifetime insurance caps. So, as president, what will you do to ensure that all children have access to the health care services that they need?
This is why it's so important to make sure that everyone has quality coverage. And the proposal I've put forward, we call Medicare for all who want it. So the idea is that you would have access to a plan like Medicare. We take it, we make it available for every American. I guess the difference between mine and some of the alternatives is I'm fine with private plans existing. Many people would prefer to be on their private plans. But I don't want to leave Americans to the mercy of the private plans, knowing that, first of all, not everybody has access to them, they're not affordable for everybody. And many people find that a private plan doesn't meet their needs, especially when you have the kind of lifetime costs that chronic conditions, whether they're in childhood or later on, can present. And so I want to make sure that you and your family can live in the certainty that your health care will always be affordable. We would set an 8.5% maximum on how much of your income could go toward healthcare payments, so that even for a family that earns enough that they don't qualify for Medicaid or the kind of subsidies that are in the ACA, you still know that it's never going to go above that threshold. Because this is also a question of freedom and of economic empowerment. It diminishes, I think, so many Americans' ability to thrive, to work, to succeed when you have to scramble to be able to just make it when it comes to health. There's also the question of affordability. If prescription drugs or treatment are a major part of this, then we know that getting everybody covered is only part of what we've got to deal with. We've also got to deal with the fundamental problem of the cost of therapies. And it's why my prescription drug plan establishes that there be a cap on what you pay out of pocket, but also set up that cap to be monthly. I think I'm the only candidate who's proposed this. And the reason is that I found that we usually experience the economy on a monthly basis, right? So usually we get paid bi-weekly or monthly. Most of our bills are monthly. And the idea of having to wait every year anxiously to see which month you're going to hit the cap, and I don't know if that's been your experience, but I think a lot of plans, that's what it's like, right? And you have to game out which month you might hit the cap. Instead, let's create that certainty and make sure that even if, again, if you're not qualifying for the subsidies, a $250 a month out-of-pocket cap is the most that you would face on the prescription drug front. I believe this is vital for women's health and for all Americans' health. And to me, this is also the pathway to what some call a Medicare for all environment would be. In other words, if this public plan that I want to create is the best one for everybody, then everybody's going to want it, and it will become the only plan. If, on the other hand, it's not the best plan for some people, then we're going to be really glad we didn't kick them off of it. And that's why I propose we have that gradual approach with, I guess, a little bit of humility based into it, that I think our plan is going to be best, but I'm not going to assume that it's better for you until you have a chance to decide for yourself.